Hello, my name is Ron Reisinger, and I'm an orthodontist here in Southeast Texas. I've been in practice for 23 years, and today I'd like to show you how we use interproximal reduction for Henry Schein aligners. An assortment of items you may need for interproximal reduction include your lightning strips of different thickness, your QwikStrips of different thickness, your discs of different thickness and different cutting edges, your boom gauge for verification of IPR thickness, and your slow speed handpiece. Options for interproximal reduction depends on how much and where you need to slenderize. I like to use these lightning strips. They come in different coarseness. They're all 0.1 millimeter thick. So the most coarse is a blue one. So I use it to break the contact. There is a non-cutting surface there, and you can use that to go right into the contact. And then you can slide it through and kind of wrap it around. That way you maintain the curvature and not create a flat surface on the interproximal. So if this is 0.1 millimeters thick and you need 0.2 of IPR, you simply just need to double it over and it becomes 0.2. And then you slide both into contact until you achieve a good thickness. And keep it rounded. And then if you want to verify that you achieve what you started out to do, you can go through, there's your 0.1, and you can see how that slides in. And if you want to see if you got 0.2, same thing. If it doesn't slide in, you need to do a little bit more. So you'll take your strip, double it over, and finish your work. And then take your 0.2 and verify. There you go. Another option for interproximal reduction are these QwikStrips. It comes first with a serrated edge, so you can break the contact, and then it comes in different sizes of thickness to get to the achievable goal for your IPR. And these are single-sided or double-sided. So to use a QwikStrip, you hold it on the opposite edge of the blade, and you get a finger rest, and you line it up with the interproximal, and you slide it through the contact. And the initial one will break the contact, and then you'll need a 0.7 millimeter, and it will go through the same way. And if your goal is to have 0.2, you will keep going until you get to that desired thickness. Never tilt or lean the strip because it will create an open contact, causing food impaction when the teeth are brought closer together. We'll go back and check with our boom gauge. See, this is 0.1. Easy. Check 0.2. And perfect. So if I need a 0.3 or 0.4 millimeters of interproximal reduction, I will always use the disc. And the first step is you want to break the contact, and I'll use an interproximal strip, as we did before, and break the contact, and I'll double it over. And now I'm going to use it as a 0.2 strip, and that will break the contact enough. And now I feel comfortable using a 0.3 double-sided disc to get the desired width. When I utilize an interproximal disc, I want to protect the patient's tongue, which you can't see, and also their lip, which you can't see. So even though I'm going to have this guard, I want to make sure that if anything slips, it's going to get my fingers before it gets the patient. So I'm only wanting to cut hard tissue, not any soft tissue. Okay, and now you'll use a finger rest. So with the patient positioned properly and my disc position properly. I will slide it through. I'm going to go back with my strip to round off any edges, and then I'm going to measure. So now you want to check the boom gauge, get to the 0.3, and I'm going to pass it through, and it goes all the way down.